Good afternoon. My name is Don Hers, and I'm the treasurer of the Community Health Endowment here in Lincoln. It's my pleasure to welcome you here today. We're pleased that so many of you are interested in the newest version, the third version of the Places Matters Community Mapping Project. It's been produced in collaboration with the Lancaster County Health Department. You'll meet members of that team that put these maps together in a moment, but first I'd like to take the time to recognize some of the current members of the Community Health Endowment Board of Trustees. Dr. John Reinhardt is back there. Dan Marvin, I think Dan is here. Marilyn Moore, there's Marilyn. Pat Lopez, who serves as the interim director of the Lincoln Lancaster County Health Department, who's the Community Health Endowment's partner in this project. And also former members, our former trustees, Diana Shemick, I think I saw Diana, hi Diana, Tom Beckius, Christina Yoakum, there's Christina. We're also pleased to welcome two members of the Lincoln Lancaster County Board of Health. Is Tom Randa? There's Tom. And James Michael Bowers, who also serves on the City Council. You'll hear more detail about Places Matters from our President and CEO, Lori Seibel, in a moment. We're especially grateful to Mayor Larian Gaylord-Bear for joining us today and offering some concluding remarks. When the CHE introduced Places Matters 4 years ago, looking at health data in this way was new to the wider community here in Lincoln. Since then, we've shared the maps with thousands of people across our community and see how people relate to the data when they connect it to where they live, where they work, and where they play, and where they go to school in our community. And we've seen people look at places in our community that they don't know much about and ask, what's happening here, or how can I help? This is the third iteration of the Places Matter. If the old saying, third time is a charm, holds true, Places Matter 3 will have an even greater impact than the two previous versions. That's because we're starting to be able to track changes as these maps change, as we're able to track those changes across some of the factors we map. And those changes give us the opportunity for more conversations about what makes Lincoln a healthy community and how we can make sure every person in our city has the same opportunity to be healthy and productive. We know that programs and policy changes have been put in place since the first of these maps came out, making a difference in the first trimester of care, in access to healthy food, in health coverage, health insurance coverage, and more areas. An African proverb says there are three friends in the world: courage, sense, and insight. With three versions of Places Matter complete, we have deeper insight into health in the place we call home. We make sense of the data by making it visual and relevant. Now with Courage to Act, we can use the information to make Lincoln a healthier community, map by map. It's my pleasure to introduce Lori Seibel, President and CEO of the Community Health Endowment, who's going to show us the latest maps.
Thank you, Don, and welcome everyone. Thank you so much for being here. It's my pleasure to talk about these maps today. But first I want to introduce the most important people, and those are members of our map-making team. They're people who really come together, look at the information, begin to decipher what this information means and how to present it in a meaningful way. And so without them, this wouldn't be happening. So from the Lincoln Lancaster County Health Department today is Raju Kalakapudi, also Deborah Byrne, Jesse Davey, is Jesse here? Jesse, and then also Lada Nawal was also part of this, and of course Pat Lopez, one of our CHE trustees. I also want to give a special acknowledgement to the late Shavana Loster, our former health director, who was very supportive of this event and this project as well. From the City of Lincoln Urban Development Department, Kurt Elder, is Kurt here? Also from Nebraska Extension, Kristen Huska. Thank you for your help, as well as Partnership for a Healthy Lincoln, a member of the LPS Board of Education, Dr. Bob Rauner, right over here. Of course, Marcia from the Community Health Endowment was a member of the team, along with Joan Anderson from the Lancaster County Medical Society, Tom Rauner from the Nebraska Department of Health and Human Services, and Dr. Rob McIntarfer from Lincoln Public Schools. So if you would give them all a round of applause, I would appreciate that. So on behalf of that entire team, I have the privilege of standing up here and revealing these new maps to you. And without further ado, we will begin that process. The first map, of course, is poverty. And I'm going to begin to morph this map from 1980 until today. It continues to be imperative that we recognize poverty as the cause of causes. It is clear that poverty is the major underlying influence for so many other risk factors. And the maps that you will see today will clearly tell you that in many ways. You know, really, if you think about it, that's why these maps are so incredibly powerful, because they can serve as valuable policy-making tools in order to understand poverty as it really exists, not as we think it exists, but as it really does exist in Lincoln. We are not immune to poverty here, but we do have an advantage, and that is these maps. Because we can target resources to specific neighborhoods, we can help locate services where they're most needed, things like public transportation, for example. These maps will help guide our efforts more strategically and efficiently than if we did not have them. Our latest map, the one that's on the screen now and the one you'll see in the book at your place, also reveals for the first time in about 10 years that Lincoln has a census tract where more than 50% of people live in poverty. That poverty line is about $25,000 for a family of four. And so what this map tells us is that we need to continue to address poverty, and in doing so, we need to go deeper, and we simply need to work harder in some neighborhoods. This map on prenatal care is from our 2017 report. It told us at that time that not a single census tract in Lincoln met our goal that 90% of women have care in the first trimester or in the first 3 months. That was an eye-opener to us. We really felt like we would be doing better in that area because we know data shows with certainty that the first trimester is the most critical time for a pregnancy. If there's exposure to drugs or to alcohol or poor nutrition or other stressors during that time, it can set the course for long-term health for that entire individual's life. So this new map tells us that now 8 census tracts meet that goal. That right there is a story of what can happen when good people do good things. It tells you what can happen when there's an enhanced medical coverage, when there is an improving economy, when there is targeted programming that go deep into places. This map and this change represents great news for Lincoln. Now there's still work to do, but maps like this also give us reason to celebrate. One of the most interesting maps that I'll probably show you today is the result of a major policy initiative, one that you all know about, called the Affordable Care Act. The map that I'm going to be showing you will show what healthcare coverage was like in Lincoln before and after implementation of the Affordable Care Act. Largely the result of 4,000 additional Lincolnites receiving coverage, the number of uninsured individuals has decreased. That's good news. This green area tells you where the percentage of uninsured has decreased. Now the yellow area tells us where the number of uninsured has increased, with the largest increase in the area represented right in this area. Perhaps the most significant data in this map, however, is showing us where the lack of coverage still exceeds 20%. So if you look at the hash marks, you will see not only where health insurance in the yellow and the hash marks indicates to you where the number of uninsured is increasing and also where it still exceeds 20%. Again, these maps serve as such a wonderful opportunity to target areas of our community and go deeper. Another reason why this data is so important is because we know that people who are uninsured are more likely to skip preventive care. And this can lead to long-term consequences for them and for our community. This map shows you that there is a correlation between those who are uninsured and lower rates for routine checkups. You know, we have made important progress in the area of providing primary care more geographically, with more geographic equity. We have had maps in the past that have shown us where our dental clinics are located, and then we also where our medical primary care is located. And those things are the product of market forces at work, there's no doubt. But the great thing these maps also show you is that since these maps were first created, we have had the planting of 3 new federally qualified health center locations. 2 of them are within that yellow area, which is our medically underserved area, and 1 is immediately north in the Belmont neighborhood. Of course, we need to continue to plant health throughout our community, but this is another reason for us to celebrate. Let's talk about tobacco use. You know, our last map book did not include a tobacco map because we had achieved such great strides in that area. Tobacco use had declined from 18.3% in 2014 to 15.6% and then to 12.5% in 2017. Those strides have undoubtedly led to better health for the people who live here. But we now know there is a new public health threat, and that is e-cigarette use or vaping. And it has emerged as a new threat to especially our young people. The health department reports that in 2019, 27% of high school students reported vaping. Now, there is much we don't know about vaping, and it will probably be a while before its effects are fully understood. But remember, that was true of tobacco as well, and it took decades to impact tobacco use when its detrimental health effects became clear. There is evidence that vaping leads to tobacco smoking, which should be evidence enough that the tide could turn against us in this regard and against the advances that have been made. So I would encourage all of us to be vigilant, to be especially informed, and ready to set policy and to fight back when the facts become clear. Childhood obesity. In 2017, we mapped childhood obesity in our community. And I can tell you that this is probably the clearest example of the value of maps, because our community had achieved a major triumph in 2014 when our data was showing us there had been a steady decline in childhood obesity over consecutive years, something that other communities were simply not seeing. Many people deserve credit for reaching that community goal that no more than 15% of children would be considered obese. And then we mapped it. And what we saw was this, that while we achieved that goal in many parts of our community, in other parts of our community, we did not. That's when the term place matters really comes into play. And so many people continue to target work in this area. Many people are continuing a valiant fight against one of the largest public health threats that we face today. But in the interim, research now shows that it is aerobic fitness that's an even more powerful predictor of illness and mortality than obesity. And what we know is that Lincoln Public Schools uses something called the fitness gram. For those of you with children, they'd come home and talk about the dreaded pacer. The goal is that 80% of children in LPS should be able to meet or exceed their grade level pacer score that dictates how we view their aerobic fitness. Currently, 19 census tracts, or 26% of census tracts, meet that goal. Obviously, our work will continue, especially in some parts of our community where we have to go deeper and work harder to address this issue. Let's look at healthy food access. Having healthy access to healthy food is not geographically equitable. We learned that from our first set of maps. In 2017, this was the map we showed you. We showed you how we were able to specifically identify areas of the community where we needed to have greater access to healthy food. What I can tell you is in this last 2 years, this community has went to work. They literally have rolled up their sleeves and done some amazing work in this regard. The community has now implemented Choose Healthy Here with these dots. That will tell you where there is now healthy food available in convenience stores and food markets where it was not before. We have implemented Lincoln Fresh, the distribution of free fruits and vegetables throughout areas that are identified on this map, literally coming tons and tons of fresh produce into these communities. We have now a mobile veggie van that goes out in the community, and its name is probably indicative of what it does. And there's also fruits and vegetables now available in school markets. And so overlaying all of that onto our map from 2017 and then watching it underneath morph till today's map, there have been positive changes. There is more healthy food now available in our community, and we should all take great pride in that. And this map also shows an excellent example of how mapping can make good use of limited resources while showing a positive impact. The last map I'll show you is life expectancy. It's one that's often the most interesting to people. And Lincoln has not seen a dramatic rise in longevity, but we have added 0.3 years since 2017. The important thing to note about that is that that increase runs counter to the United States, where on a whole, longevity has decreased for 3 consecutive years. So this map still shows there is a 20-year gap between the core of our city and to the very edge, largely due to the layering of these risk factors of which I have been talking about. We still need to work hard. We have done some really incredible things thanks to the people in this community, many of you who are in this room right now, but we still have work to do, and the fight is long from over. And so this map would not be complete, however, if I didn't return to where I started, which is poverty, the cause of causes. The correlation is clear, and it's important that we take socioeconomic conditions into consideration in all of our approaches. So as I think about the last 4 years, and as if we have revealed these maps, like Don said, to thousands of people, and as we go on the road to reveal our new maps, which we will be doing if you look at the card here, and talking about them in neighborhoods, and here if you want to come back and hear a deeper dive into the maps, or if you want to invite people at your agencies or people you know to come hear about them, this is a great place to do that. We're also going to tell you at those events what we have learned ourselves about talking to people, thousands of people. I'm going to be honest with you in telling you that some of those things are as challenging as they've ever been, but I will also tell you, in many ways, things are clearer than they've ever been. I know this. I know that to create the healthiest community possible, we cannot not become divided by class or race. Doing that is only going to go work against the very gains that we've made to this point. I know this, that our healthcare system, as wonderful and as world-class as it is, will never be well-equipped enough, nor was it intended to be, to address social determinants of health. Things like affordable and safe housing, the availability of healthy food, stigma related to mental illness. Those are our responsibilities as citizens and individuals who care about this community and the people who live here. As a society, we cannot rely on health professionals and hospitals and clinics to always make us well. We must rely on ourselves to make good choices, but we also must rely on each other to be supportive and generous, and we must continue to prioritize a culture in this community of wellness and healthy, active living. I do know this, and I stress this every time I talk, and I will continue to stress it for as long as I have the forum to do it, and that is we have to do everything in our collective power to invest in our youngest children, especially those between the ages of 0 to 5. The impact of poverty, the lack of prenatal care, violence, other toxic stressors are going to change their brains forever. And this is a bold statement that I will say, but I believe it to be true, and that is that the needs of our youngest and most vulnerable children will likely be the legacy that our generation leaves. And lastly, it's important to remember that a single program or a single approach will not work in addressing the challenges before us. This is about collective will, and this is about community priorities, and this is about setting aside differences and investing in this place that we call home. So I know someone, at least one person I am undoubtedly believe agrees with me, and I'm fortunate to introduce her to you today, and that is Mayor Larry Ann Gaylord Baird. Thank you so much for being
here. You mentioned the maps were our big advantage, but I want to say the big advantage is you and your team at the Community Health Endowment and our wonderful Lincoln Lancaster County Health Department and all the people in this room who are making a difference and who care so deeply about these issues. We at the city, of course, share the Community Health Endowment's vision for making Lincoln the healthiest city in the nation. And just as an aside, I didn't know my former boot camp instructor would be here today. It's like a silent message that I need to stay strong and get to the gym. The maps selected for the third Place Matters report represent some of the most challenging issues facing our community. And Lincoln has made significant progress, as Lori has described, since the first were released. Targeted efforts to address health disparities in medically underserved areas and to provide greater access to healthy food have resulted in better outcomes for our residents. Yet we know that many challenges still remain. More of our residents live in poverty and face uncertain futures, just as they did 8 years ago. Life expectancy for residents in poverty is lower than those who do not live in poverty. And while the life expectancy gap in Lincoln has decreased since the last edition, the life expectancy gap in Lincoln has decreased since the last edition of the Place Matters report, there is still a nearly 20-year difference in life expectancy in separate areas of our city, separated by only 5 miles. While life expectancy does not perfectly predict an individual's lifespan, this gap helps us understand the disproportionate impacts of poverty, the lack of economic opportunity, and the violence on our residents. Ensuring that everyone in Lincoln has the opportunity to reach their full potential, no matter their zip code, is a core priority of my administration. And that's why, in addition to continuing to take care of the basics that you depend on city government to take care of, we have launched an initiative to advance equity, diversity, and inclusion in our city. This initiative, called One Lincoln, which is being led by Adele Burke out of my office, is an extension of the incredible work that CHE, the health department, and our community partners have done to identify and address disparities in Lincoln. And as we provide services to the community, we will continue to ask, who is benefiting the most and who may be left behind? The data collected by the health department and compiled in the Place Matters report are essential to this effort. This tool will be used to focus valuable resources where they can have the most impact to protect and advance health, safety, economic opportunity, and quality of life for our residents. And over the next year, the health department will be expanding the use of data analysis, thanks to our rock stars who are here today, to improve the availability of public health data for the City of Lincoln and Lancaster County, providing an additional tool for the city and our community partners to improve outcomes for our most vulnerable residents. Hot off the printer, it's kind of sticky. Place Matters tells the story of those in our community who are experiencing the greatest needs. And it encourages us to examine what we believe about equity and opportunity in Lincoln, and to understand the experiences of those throughout our community beyond our own neighborhoods. And it calls on each of us to do our part to improve outcomes for every resident. I really want to thank you again, Lori and your team at the Community Health Endowment, and those at the Lincoln Lancaster County Health Department for continuing to lift up the importance of equity in our community and for inspiring us and challenging us to do even more. Thank you.
I just want to remind folks that at your place is a copy of the 2019 report. We are available to come out and speak about the maps if you have anyone who you believe would benefit from that. We also have the large copies of the map. Take your time and look at them a little more deeply. And also, again, to remind you of our community conversations, 3 of them that we'll be having regarding place matters. I want to conclude by thanking you for being here. We'll be taking some questions if you would like, but also to again thank the mapping team, the health department, Dawn, thank you, the leadership of the Board of Trustees, those who are here and those who couldn't be here, and of course, Mayor Gaylor Baird, we're very deeply grateful for your leadership. With that, we'll conclude this event and open the floor to questions if you have any. Thank you for being here.